Now recognize Ms. Miller-Meeks of Iowa for her 5 minutes of questioning.
Thank you, Mr. Chairman, and I thank you to the witnesses for testifying before the subcommittee today. Unlike probably most members of our august committee, I actually volunteered in nursing homes, volunteered in mental health hospitals, was a student nurse prior to becoming a nurse, then continued to do nursing while I was putting myself through medical school. So it's an issue I might know just a little bit about. My district that I serve in Iowa also happens to be a rural district, although we have urban areas as well. CMS's recent Medicaid access rule included a proposal that would require states to spend at least 80% of all Medicaid home and community-based service dollars on direct care workers. Many states have expressed concern with this rule, primarily with CMS's decision not to permit exceptions to the 80% threshold. This will likely impact two groups: small and new providers compared to large established providers, and rural and frontier providers who often have fewer options to optimize administrative costs and higher cost of recruiting and maintaining staff. This is a major concern for rural states like Iowa. CMS might want to consider alternative approaches, such as scaling threshold based on provider size, rural-urban status, risk of closure, and/or an exceptions process for small providers. Of course, not all entities would utilize this process, but offering flexibilities to account for the geographic differences and challenges associated with those differences would make sense. And I know this personally, having cared for my mother with Alzheimer's, who was in Oklahoma, and I was in Iowa. And she lived with us for a year before going back to Oklahoma. As the chair of the Subcommittee for Veterans Committee, I also want to focus my concern not only on what I think the impact will be for Iowan seniors and people with disabilities who depend on Medicaid home-based services, but also our veterans who are increasingly relying on home-based long-term care. A 2020 GAO report indicated that there is significant growth in veterans receiving home care and other home-based services. While veterans can receive this care through the VA benefit, many also receive home care services through Medicaid home and community-based service waivers. Regardless of the payer, the providers that are being targeted by the Medicaid access rules payment proposal serve both our broader population and veterans. Ms. Killau, given already limited provider resources in Iowa, I'm concerned about what the Medicaid access rules impact will be on provider networks to meet current and future needs of Iowans, including veterans. Can you talk a bit about how implementing this rule could affect the home care provider network overall, and what happens when individuals cannot receive home-based care?
Thank you for the question, Representative. You touched on it. First of all, you know exactly what the issue is. If they do not have the adequate, first of all, rates to pay, they need the funding. If the 80% rule goes through as written, that means providers will close or they will not open up, and we need the expansion to deal with the growing population. And so we will have issues, and clients will not be able to receive care ultimately and maybe turn to a nursing home setting.
Which is much higher cost.
Absolutely.
Ms. Schuman, to meet the proposed staffing levels, nursing facilities would need to hire an additional 1,417 direct care staff or reduce resident count by 2,559, or 13% in Iowa. However, such workers are not readily available, and that's regardless of pay. And recruiting and retaining them would significantly drive up costs for all healthcare providers. I will also note that 17 nursing facilities in Iowa closed in 2022, 15 of which were in rural communities. Can you please discuss the impact of the current healthcare workforce deficit and how the proposed staffing ratio would influence that impact, not only in the nursing home setting, but across the care continuum?
Thank you, Representative. I think you mentioned it well, that it would drive up costs. And currently in my state, we had a proposed Medicaid rate to go in effect of July 1st, and we have yet to receive the dollars from that because the proposal and the approval is on CMS's desk waiting for approval. It's a very complex system and a very complex process. Access to care will become an issue. People will either have to limit the admissions into their communities or they will shut down. And as you mentioned, rural communities are disproportionately impacted, and underserved communities are also disproportionately impacted.